All right, so I'm Melanie, and then this is Marguerita. She goes by Margot. And so we are here to talk about the therapist's approach to post-polio syndrome. I think this is I want to thank you all for inviting us over and listening to us and giving us your time. My father-in-law, who passed away this year, but he had suffered from polio syndrome as a child, and my aunt also is currently in the Philippines. She also had polio as a child as well. In 1979, in the United States, polio was eradicated. In the Philippines, it was eradicated only officially in 2000. So that's pretty recent, but it's still actually still a high risk for it actually coming back because they're not doing a very good job yet. They're not exactly there in controlling and keeping track of that. So that video that we had seen earlier where it says we're this close, it's absolutely true. We're this close, right? Because it's eradicated. There's 3 countries right now where it's not officially eradicated. So we're almost there. So I think this is a great cause. I think this is something that we still need to be very much aware of and still be very much aware of how to stay vaccinated and how to also treat those who also have already suffered from it, right? All right. Oh, there's my next. All right. So pretty much post-polio syndrome. We're going to be here to talk about a lot of the ways to address strength, how to address pain management, cardiovascular health, and then work on body mechanics too. So those are the things that we need to really focus on when we call this the post-polio syndrome. So just a little background. Essentially, post-polio syndrome is what happens after you've already suffered from polio as a child. So I don't know how many have actually been diagnosed with officially post-polio syndrome, but what's happening, right, I saw some hands going on, is that when you have polio, right, you have the denervation of nerves. You have a destruction of nerves. You have the treatment of the polio virus, and then you can have that whole healing, all of the nerves and that network can kind of regrow again. And that's why you can get some function back. With polio syndrome, the theory is really that we have these new nerves that have grown, but now they're getting a bit tired. So now some of those nerves have been starting to kind of get de-sprouted, and now there's a weakness, and you're suffering from fatigue, and you're suffering from a lot of weakness, again, with gait, with posture, with all of those such things. So pretty much there's 1.63 million survivors in the United States, and 1/4 to 1/2 of them will actually develop post-polio syndrome. 20 to 50% of those polio survivors that suffer from post-polio syndrome a majority of them are women. So it's a higher prevalence in women. It's characterized by weakness, decline in functional ability, and reports an increased fatigue. The best way really to diagnose post-polio syndrome is through EMG. Post-polio syndrome is a diagnosis of exclusion. So pretty much if they can't explain other reasons as to why you're having muscle fatigue, they'll do the EMG. They'll see how your muscles are functioning, and then they'll see if there's also a destruction. So this slide right here is just talking again what I was talking about of how with polio syndrome you're having that neuronal degeneration again. And in post-polio syndrome, that's kind of what's going on again. All right. So to diagnose, you have to obviously have had polio syndrome as a child or earlier in your life, and then you have to have a whole set of symptoms. So you have to have muscle fatigue, you have to have muscle weakness, you can have some atrophy. And then it gets confirmed with the EMG. And again, it's a diagnosis with exclusion. What's that? What? Oh, slide behind. Oh, I'm a slide behind. Sorry. There's a slide behind. There's a diagnosis slide. I don't do this technology thing. All right. So this is our therapist approach. It's the ways we can address strength, pain management, cardiovascular health, and body mechanics. So essentially treatment. Yeah. Oh, great. Thank you so much. So the big focus here, right, with post-polio syndrome is fatigue. When we are exercising, everyone knows that exercise, you're going to get yourself stronger. You're going to get yourself a little bit more efficient in endurance. With post-polio syndrome, you want to also make sure that you're not exercising to the point of exhaustion. And I think a lot of us here are fighters, we're strong, we want to keep pushing. The crucial part here is that you want to make sure that you're not going to the point of exhaustion here. With post-polio syndrome, we have decreased peak workloads, decreased oxygen uptake, and so your goal is to improve endurance and improve functional capacity. So you want to aim at non-exhaustive exercises, and general body conditionings are preferable. We have our orthotics table over down there, and the use of orthotics is definitely recommended because that can increase your efficiency in gait. It can decrease the loading on your joints. It can help you pretty much just move better and move freer. With physical therapists and occupational therapists and any sort of medical doctors, they can help you be that middleman to find a better orthotic for yourself. And again, it's specific to your body type and specific to what you need. They found with assistive devices, and I see a lot of you guys also are using it, which is great, because they have found that there's an increase in cadence, so increase in walking speed, increase in better mobility when you're using an assistive device. And it also decreases your workload. So again, if you're suffering from fatigue, if you have poor endurance, that an assistive device will also assist and make you be able to function better and walk prolonged periods of time. There also is a new study using exercise and a combination of cognitive and behavioral therapy. So having those two together can help focus on decreasing your fatigue. There's no specific study for Tai Chi and post-polio syndrome or polio survivors, but there is a lot of studies for Tai Chi for balance in general. So that would be something that was really beneficial for you. It's a lot of slower pace movements. It's focusing on your form. It's focusing on breathing. And those are the things that a lot of us need to really focus on. A physical therapist and occupational therapist, we can all look at your gait as well. So individuals with post-polio syndrome, they have muscle weakness. They have issues with the vestibular system. They may have issues with vision. They can kind of bring that together and help and make your walking more efficient. And so there was this one study, and they even just saw engaging in physical activity for 2 times a week have actually been found to be beneficial. So even just having some sort of exercise routine twice a week, focusing on gait, focusing on function, increasing your endurance, those were going to be found to be beneficial for you. And so again, a physical therapist can consider these findings in developing an overall plan of care for function and health. And we'll talk a little bit more about this, is because I can't just come and say, hey, this is your plan for polio syndrome, or this is your plan for post-polio syndrome. You have to be evaluated specifically because we all here function differently. So these are just the American Physical Therapy Association general guidelines. So pretty much exercise should not cause muscle soreness or pain. Exercises should not lead to fatigue that prevents participation in other activities that day or the days following. Strengthening exercises should only be attempted with muscles that move through their full range of motion. So pretty much you're not forcing let's say your shoulder can't reach all the way to the top, you're not forcing your shoulder and especially adding weight to go further than it can. Minimal to moderate intensity exercises is generally recommended. Progression of exercise is slow, especially in those muscles that have not been exercised for a period of time or have chronic weakness from the initial polio virus. So you want to make sure that you're not progressing too quickly. And that means increasing the frequency too quickly or increasing the workload too quickly. They've also found that stretching is very beneficial, and the use of aquative exercises as well, because in the water it can de-weight you, and it can really help decrease the load off of your joints. And especially exercises such as yoga, right? So some people here have done the chair yoga. That's really beneficial. It can help focus on stretching, breathing, and posture.
So now I'm going to address some of the types of pain that some of you as polio survivors may be dealing with at this time. The first one up here is post-polio muscle pain. And this is muscle pain that occurs in the muscles that were previously affected by the polio virus. So this is where you're going to feel a twitching sensation or muscle cramping, and usually occurs later at the end of the day. And it's mostly because those de-innervated muscles that are being affected now, they don't have the strength to continue through most of your day. So you're getting a lot of soreness and muscle cramping pain in those affected muscles. The other type of pain is overuse pain. And this is the type of pain that you get when you do types of exercise. So when you think of someone that goes to the gym and they're feeling really sore the next day, that occurs in everybody. So this is when you overuse muscles, so you went for a longer walk on a certain day and your muscles are feeling tired. You did a little bit more and your muscles are just feeling sore and tired. And then the last one here is biomechanical pain, and this is the pain that's usually caused by degeneration in our joints. So after years of being able to move with different types of braces with a different gait pattern, sometimes our joints tend to break down. So this is where you get that arthritis type pain. And it could occur in your knees, in your ankles, shoulders, hips, back. This kind of pain can really happen in any structure of our body. Okay. So then ways that we can address our pain. So the first one with post-polio pain, the biggest thing to address it is to use energy conservation techniques. So being able to save these muscles that are having a hard time keeping up with our daily routine from overworking themselves throughout the day. And as this pain comes at night, we just want to make sure that we are giving them the rest that they need during the day so that we're not affected by this kind of pain later in our day and at night. There has been shown some medications can help with it. From research that I've been able to see, antidepressants and certain things like that, but that's something obviously you would talk to your doctor about as well. Overuse pain. Okay, so resting from exercise and then using things like heat and ice and over-the-counter pain medication can help those aching muscles and joints. A physical therapist can also help you with muscle release techniques. So when you're feeling extra tight, you can go and see your physical therapist and they can work on a routine with you to get you through doing a lot of those stretching activities to relieve a lot of that muscle overuse pain. And then biomechanical pain. And this is the one where you tend to look at more use of assistive devices to help. Knee replacements, hip replacements, if those are options for you, just to alleviate these things because it's at such a biomechanical level. So arthritis in our hips or in our knees, the more we walk on them, the more they're going to hurt. That's just the fact of life there. So working with a physical therapist to improve your body mechanics can help to alleviate a lot of this pain, and working with your doctor. So using a team of orthopedists and rheumatologists can kind of guide you through what this biomechanical type pain is causing you so that you can address it. Go on to our next one here. Cardio health. Okay, so another way with just maintaining your overall body health is being able to keep up with cardio. So being able to get your heart pumping and your lungs working so that you have more energy throughout the day, your body is getting more oxygen. With post-polio and with polio survivors, the biggest thing is that you need to remember to do cardio in a way that is not going to affect your affected muscles. So we don't want to promote getting that post-polio pain. So when your legs are affected, you want to do a cardio routine that uses more of your upper body. So using an arm bike or a UBE or doing aquatic therapy can get you that cardio while saving some of the strength and endurance in your legs. And the opposite is true if you're more affected in your upper extremities. You can use a new step or walking on a treadmill or anything like that, using a recumbent bike in order to get your cardio, increase your heart rate, and work on your overall health, but not affect those muscles that tend to get more affected with post-polio syndrome.
So we're talking a lot about making sure that you're not overdoing it. It's not saying that you should not be doing an exercise routine, that you're just pretty much not getting any sort of benefits. So how do you know when too much is just too much. We have the scale of rating of perceived exertion. So this is a 6 to 20 scale. The reason why they've started from 6, so 6 means you're not doing any work, 20 means you're doing an intense workout. The reason that they did a 6 to 20 is because it also correlates with your heart rate. So around 6, if you're about a 6, your heart rate's at a 60, right? That's just the general guidelines. If you're doing, if you're at a 19, which is super hard, a very, very hard, then your heart rate's going to be around 190, right? It's just a general. So with post-polio syndrome and polio survivors, they have a study showing that once you're hitting that 17, you really should back off, right? So that's the very hard. And the reason that they did that is because around 17 is where they found that if you go any further than that, you get muscle soreness, and it's very hard to recover after that exercise. So below 17, you can actually do the workout, you'll get benefits, you'll feel like you had your muscles working, but then you'll be able to recover that day and go back to your regular routine. They also have another general scale, which is 0 to 10 scale. That doesn't correlate with heart rate, but again, sometimes it's a little bit easier for people to understand, knowing that 0 is no work and 10 is very hard too. So whichever, you just want to make sure that you're getting at the hard part of your exercise, and you're not exceeding and saying it's very, very hard. So with physical therapy, the big thing is posture, posture, posture. That's the first thing. Right? And so if we look at this picture, we have our evolution and how we're going now towards the evolution of being in the slouched position. We are all on our phones, we're all on our computers, and this is just everybody. This is not just indicative just for this population here. This is all of us. So everyone, just start to slouch now. Everyone slouch, and then try to lift your arms up. How far can your arms actually go? Slouching that hard? Does it even feel good for you? So for all of us, and even those who are with suffering from polio syndrome or a stroke, anything, we're always focusing on posture first, because we have to learn how to work efficiently. And even just general people who come in for shoulder pain, they're like, why do I hurt so much? And they're standing like this. It's like, well, I think it's because your posture, right? And you get them standing upright, and automatically they feel so much better, and they can create more range in their shoulder. And the other part is everyone slouch and try to take a deep breath in. How difficult does that feel? So you're taking a deep breath in, and you're working so much harder. And again, if you are struggling to breathe, or you're struggling with endurance, and now you're coupling poor posture with that, it makes things a little bit more difficult. So again, we're trying to learn how to make things more efficient. So a good segue from we talked about breathing is what is correct breathing? A lot of us don't really know how to breathe properly, and that's the entire population. So a lot of people tend to breathe with their chest. So I don't know who took the yoga class in here, but they do a lot of focus on breathing. And being a yoga instructor myself, breathing is probably the first thing that I'm always focusing on. And again, it's posture coupled with it. So we're focusing on how to open up our thoracic cavity so that we can increase more efficiency with our breathing. But again, it's also making sure we're not using those neck muscles, right? So we're not breathing in through with our chest and with our neck. So the one strategy, this is a great strategy, is pursed lip breathing. So the cue that we've always taught is you want to smell the roses and blow out the birthday candles, right? So you want to take a deep breath in through that nose, smell the roses, and then slowly blow out all those birthday candles. And you want to make sure that that breath, that exhale, blowing out those birthday candles are going to be a little bit longer than smelling the roses. And that's just a great strategy just to finally start to learn how to control your breathing. And with breathing, it's going to increase your work efficiency, it's going to increase your muscle endurance, it's going to allow the oxygen to go through all of your muscles, but also creates a relaxation technique. And with all the stress that we have in life, it actually creates a change within your sympathetic nervous system, teaches it how to turn it off, and you can actually relax a little bit more. And so you want to practice this throughout the day, multiple times a day, until it becomes second nature. And we use this strategy a lot even for COPD. This is the best strategy for them because they have, those with COPD also have trouble with that controlling of the breath. But let's say you don't have COPD, you now want to try to transition to diaphragmatic breathing. So if you place one hand on your chest and one hand on your belly, take that deep breath in. You want to feel that stomach expand. You want to make sure that chest doesn't rise with it. So that's pretty much what's happening. You want to feel that your stomach expands up and your stomach relaxes down when you take a breath out. And a lot of people have that trouble. They actually reverse that. They call it paradoxical breathing, where they actually do an opposite pattern. So you really want to try to focus on that. But if this is too challenging for you, stick to the pursed lip breathing. This is the next step, okay? Oh, this is you.
The next area that we're going to talk about is some energy conservation and what it means and how we can apply it to our everyday lives. So up here I have what would be considered the goal of energy conservation. And that's where we want to save our energy throughout the day so that our energy lasts so much longer throughout the day. And there's pretty much 8 principles to energy conservation. So the first one is limiting the amount of work you set yourself out for. So you have a day off. You don't want to be doing every single thing you possibly can. You're not going to run 25 errands on your day off. Planning ahead, so getting a schedule for yourself so that you know what you need to do and you know when you can fit in some rest breaks and some times for your body to recover. Number 3, organizing your storage and workspaces. So making your environment work for you. When you're in the kitchen, are things placed in an area where it's easy for you to get to so you don't waste energy looking for them? Number 4, sitting to work whenever possible. So just like we were speaking of before, sitting down is going to save more energy in your legs. So can you do your work sitting? And housework, cooking, cleaning, anything like that. Using the correct equipment. Here we're going to talk about some adaptive equipment that you can use for activities like dressing, bathing, showering, anything like that to make those activities easier and use less energy. Using efficient methods. So this is a work simplification area. So instead of making a meal and having 25 steps, can you cut that down to 5? So making the activities much quicker and easier to do to save yourself some energy. Number 7, planning and including rest breaks into your day. Goes along with planning ahead and scheduling as well. And then, as Melanie was talking about, using correct body mechanics. So having that good posture to keep your energy levels up, and some other things we'll talk about as well. Okay. So the first thing we need to do when we talk about energy conservation is, Melanie showed you that scale, but bear aware of your energy level and how much energy activities are going to take away from you. And a good way I like to think about this is like we all use our smartphones now. So if you think of yourself as a cell phone, if you were coming here this morning and you had to have your GPS on, you were calling your friend who was on the way, your battery is going to start to drain. So using all of those things very early in the morning is your phone might not have anything left in the tank if you don't give it some time to recharge by the end of the day. So you want to be aware of how much energy certain things take up. Using our GPS uses a lot of energy on our phones. Doing a lot of activity in the morning uses a lot of energy in ourselves, okay? Planning those tiring activities for later in the day. So you don't want to have to empty the tank so early in the morning, and then by the time you get home and you're ready to start going to bed, you don't even have the strength or the endurance to get through your nighttime routine. Avoiding the burning best energy levels. So you're feeling great, you're having a good time, you're out with your friends, and having a great lunch, but you're a little too hard. So then you get home and now you're exhausted. So what are you going to do for the rest of the day? So really knowing how much energy you can expend for certain activities. And then scheduling rest breaks. So just like we need to recharge our phones, we need to recharge ourselves. So you just need to make sure that you know your energy levels, give yourself time to recharge so you can reset and continue with doing your activities. So the next section we have just some tips and suggestions to work in some of these energy conservation techniques into your day. And as an occupational therapist, this is one of the areas that I work on most with patients, is getting to know energy conservation techniques. So occupational therapists work on activities of daily living. So activities of daily living can be anything from doing your showering, your dressing, being able to stand at the sink and brush your teeth, being able to cook a meal, go for a drive, go to the store, any activity that you're doing during the day, we can help guide you on ways to make those activities a little bit easier and a little bit safer and more efficient to do. So the first one here is when you're doing dressing. You want to prep, okay? So if you have a little bit of energy left at night, getting all your clothes for the next morning, that's going to save you some energy in the next day. You're not going to have to go to the closet, to the dresser, down to the laundry to get everything ready. If you have a little bit of energy, you want to get it done maybe the night before. So working in that into your schedule is important. Okay, using body mechanics is another important thing when you're using dressing. So we want to avoid having to bend down to put on our socks and our shoes as much as possible. Bending down causes more fatigue. So if you can, you want to be able to bend your foot up to your knee. We call this the figure 4 position. Or you can use some adaptive equipment to get down there. The use of reachers and sock aids is a very big help in doing lower body dressing in order to save a lot of your energy. Fastening your bra in the front and then turning it backwards. I know sometimes I get out of breath. So using low-handled shoe horns to put on your shoes so you're not struggling to put on a sneaker or a shoe to holding your breath while you're trying to get it in. Sitting down while you're dressing to save yourself some energy. And then, as I said, using adaptive equipment. And then the last point there, making your clothes work for you. I think we're at a point where clothes are getting a lot easier for us to manage. No, you don't have to iron as much as you used to. So consider buying clothes that are wrinkle-free or less likely to wrinkle. Shoes with elastic laces so they're easier to put on and put off. Front opening and loose-fitting clothing. It's just going to make dressing so much easier for you so that you can get through that activity without using as much energy as you previously needed. So here are some examples of adaptive dressing equipment. So that first one, I think this is the pointer there. This first one here is a sock aid. So what it does is you put the sock on it, and then all you have to do is drop it to the floor, stick your foot in it, and pull it on. And 3 seconds later, your sock is on without having to bend down or pick your foot up or do any of those energy expending activities. The second one here is a dressing stick. So using it to put on or push off your lower body clothing. Long-handled shoe horns, this one here, just so that you don't have to, once again, bend down to do those. And then the use of a reacher. I use these a lot with patients to put on lower body clothing, pants and underwear, and socks, and just help out a lot of that. It's pretty much an extension of your arm, so that you can do those activities a lot more independently and with a lot less energy used. So here are some techniques. Like I already mentioned some of these while we were talking, but when you're dressing, putting on your more affected side first, okay, is going to make getting dressed a whole lot easier. And then when you're undressing, taking that side out second. When you're putting on pants, you want to make it simple. So this goes into work simplification activities. So how many steps are you going to put into this activity? Are you going to put on your underwear, then stand up, then sit down, then put on your pants, then stand up, and then sit down again? No, you want to make this activity work for you. So you want to put on all of your underclothes, put on your pants, and then finally stand to pull them up to your waist. Bathing and showering. So this activity, it uses a lot of energy. This is probably one of the most exhausting activities that we tend to do most of the time, mostly because we're in a hot environment, and that increase in temperature makes us a lot more tired. So we want to install grab bars or use an elevated toilet seat or shower chair. So we want to save as much energy during this activity as we possibly can. So being able to sit down or hold on to something to help us balance. You want to put things at a height where it's easy for you to get them. If you're standing in the shower, don't have your soap or shampoo low in the corner. You want to have it at a height that's easy for you to grab so you don't have to waste energy bending down for it. You want to use long-handled sponges to get down and do your lower body bathing and showering. Using warm water or tepid water instead of a very hot shower, just to save more energy, to keep your circulation a little bit lower. As we use more heat, it tends to rise, it uses more energy in us, okay? Using a robe instead of drying off, treat yourself. You know, we always want to just, it's luxurious to sit in a robe. Consider showering at night so that you can go directly to bed after. So you have that energy, whatever's left at the end of the day, get through your shower, and then you have a wonderful night's sleep to rest. Some activities for cooking, okay? So like I said before, arranging your prep environment to ease access. If you're using things fairly frequently around your kitchen, you want to keep those things at a level that is easy for you to get to, so you don't have to reach into high or low cabinets. If you can, keep things on your counter. Use convenient and easy to prepare foods. I think we, a lot of people like to cook. I come from an Italian household where we cook every night. So, can you make that activity a little bit easier to do? It might be, possibly getting a prepared meal, maybe once or twice a week, just to save yourself that energy and that time. Using small appliances that take less effort, and I'll show you a couple of those on the next slide as well. Sitting down while you're preparing, bringing all your tools and everything to the table, sitting at the table, or using a stool at the counter. Sliding heavy pots and mugs, so it's going to use a lot less energy, and it's going to be safer for you if you're boiling pasta to bring it over to the stove if you slide it across the counter as opposed to carrying it across the counter. Preparing double portions and freezing half. I learned this in college. And then using disposable paper goods and utensils. I know it'll just make that whole cleanup a whole lot easier. And then if you are going to be using regular dishes where you just soak it and let them dry overnight, use the use of a dishwasher, okay, just to make it cut as many parts of that activity out as you possibly can. Okay, and then here I have some adaptive cooking equipment. Okay, so that first one up in the upper left-hand corner is an adaptive cutting board. So it just makes cutting a little bit easier. There are some prongs that you can put your vegetables on so you're not struggling to hold them into place or anything like that. It makes cutting a little bit easier to do. Handles to help open jars. I know that's a big thing, especially when our hand strength is compromised and we're getting a little bit older and things are just a little bit tougher to get through. Using tools like this are a lot easier to make to prepare those meals. This one here is an herb cutter, so when you're doing a lot of your meal prep activities, you can use an herb cutter or like a chopper in order to get those done in a pinch, as opposed to standing for 10 or 15 minutes and working at something with a knife. And then some adaptive forks, knives, and spoons here. So as our grip strength decreases and sometimes we have a little bit more of difficulty with the use of our hands, using things with larger handles tends to make doing those activities a little bit easier. So if you're having some trouble holding onto a fork or a spoon, using a fork or spoon with a thicker handle can help you regain that independence so you can do it by yourself again. Okay. Household chores. So working with patients, a lot of times that come into my office, they come in because they're having a hard time keeping up with their housework or doing things for themselves. So the first thing we really work on is usually creating a schedule with them. So how can they schedule their week in order to make the most out of it? And that we also try and work in some rest days. So for an example up there, dusting the house on Monday, and that's all you do. And then you may want to vacuum on Tuesday, not trying to do both of those activities together. Get your shopping done on Wednesday and rest on Thursday. So you want to work these activities in so that you can work in some rest days so you don't overuse all of your energy. Long-handled dusters and dust mops. Okay, once again, we don't want to be doing too much reaching up or reaching low. Using a cart to move supplies around your house. Dragging or sliding objects rather than lifting, same kind of activity in the kitchen. Doing things sitting down. So can you sit while you're ironing? Can you sit while you're folding laundry? It's going to save you a lot of energy in the end. And then delegating heavy housework. So, tell someone else to do it. Shopping, okay, this is a big one. So when we go shopping, a lot of times, it can, what you think is going to be a 2 minutes walk into ShopRite becomes an hour in ShopRite, and you never know what's going to happen. So you really want to plan a route. So have an idea of what you need when you get in there, and then be able to get in and get out as quick as you can. Using a shopping cart for support, or anything to give you the support you need to prolong if you're walking through ShopRite or the store. And then when you get home, lighten your load to bring in your groceries. Instead of taking one trip trying to carry 16 bags, you might take a few more trips carrying lighter loads, or you can use a wheeled cart to bring more into your house, and then you can get it done a little bit easier. And in this section over here is work simplification. So as I said before, getting these activities that we're doing down to the least amount of steps needed. So if I were to start an activity and end an activity, if I went through 1, 2, 3, 4, 5 steps to get to the end, that's going to use a whole lot more energy than if I were able to do it in 1 or 2 steps. So you want to do to shorten things up as much as you possibly can. So doing these work simplification techniques, we want to avoid multitasking. So if you're doing something, you just want to avoid having a million other things going on. If you're cooking a meal, you also don't want to be, making a phone call, or, having the laundry on, so you have to change it from the washer to the dryer. You want to be able to sit down and do your activity and get it done with, okay? When you're cooking, you can buy pre-chopped vegetables or shredded cheese. So you want to cut out as many of those preparation activities as you can. Dressing, like I said before, laying out your clothes and getting everything done beforehand. When you go shopping, sometimes, I know this happens to me all the time, you walk into the store and the floor plan is completely changed. Sometimes you can go into the store and they can give you a map of where they have moved things, so that you can kind of plan what aisles you need to go down and not waste your time going down certain aisles. It tends to, I feel like they change every month. And then cleaning. When you're cleaning, instead of putting things away one room at a time, set up an area in your home where if something needs to go up to the bedroom, you put it in a bin, and then when you go up there, that bin goes with you, so that you're not making that trip a whole bunch of times throughout the day.
All right, so pretty much just to sum everything up for rehab, in terms of rehab intervention, a PT and OT can help create a customized plan that can help reach your goals. I know with physical therapy and being back in school, a lot of the research is now going into what's called treatment-based classification system. So it's not like you come in and you say, I have polio or I have post-polio syndrome, and we create this plan based on that. No, you come in with a set of symptoms, you come in with a set of goals, and that's what we're actually looking at. We're looking at you as a person and at your personal goals, and we're not looking at you at just what sort of diagnosis you have. So that's the crucial part in seeing your therapist, or even just a personal trainer, just so they can create that one-on-one personalized treatment for you. Polio and post-polio syndrome both present with such variability. So do you look like anybody else in this room? Do you walk like anybody else in this room? Do you have the same lifestyle as somebody else in this room, or anybody in the world? And the answer is no. And so there's so much variability with it, and so that is why it's so important to just create a own plan that works for yourself and not just what works for that syndrome, right? So the most important part is don't be identified by polio or post-polio. You are not a polio woman or a polio man. You are someone who has a set of symptoms, and so you want to make sure that you're just listening to your body. And I think that's the biggest takeaway that we want from we want you to get from this. Know your body, your level of energy, and get a good understanding of the things you want to do each day. Plan ahead, maintain fitness level and health to decrease pain and increase independence. Reach out for assistance when needed. A physical and occupational therapist can help guide you through an exercise program and educate you on techniques for simplification. And, yep. There you go. Hey, thank you.
Okay. Yeah, some questions over here.
Yep. Yep. So there's different techniques. So we just call it a general soft tissue mobilization. So it can be myofascial or it can be a different technique. So we would just see which technique you'd need. So that's determined by your therapist when you get evaluated. So it determines if there's some sort of trigger point that needs to get released. That's also determined by if there's some sort of muscle inhibition. So we'd look at all different types of how you're moving and see what actually needs to happen. Mm-hmm. Yes, yep. Definitely. Yep. Yeah. And I've gone through a lot of schools, so I've gone through different programs, and each program that we've talked about it, too. Mm-hmm. So to be perfectly honest, as long as you tell your doctor, okay, these are my goals, this is what I'm having issues with, I want to see a physical therapist, as long as the prescription says evaluate and treat for physical therapy, then you're golden. They don't have to write anything specific. A lot of doctors will write things, but again, then the PT just looks at it and creates a customized plan based on a script. No, it could be anybody. Again, you want to just ask them, are they working with special populations? Are they working with gait and balance? Are they working with, or do they have a familiarity with that? Again, you learn about it in school, but again, it's different working with someone with the syndrome, so you want to just be you do want to shop around a little bit. I'm sorry, I'm just going to go here just because you. Yeah. Mm-hmm. So really the big thing is don't be afraid to talk to your therapist or to even your medical professional and even your doctor. You want to make sure that you are seeing a gain within 2 weeks. So if after 2 weeks you feel kind of about the same, nothing really changing, you don't even feel stronger, you don't feel any balance, then you want to talk to your therapist and say, hey, we need to change something. And I am very open, and again, if you're sitting there for 30 minutes, I've had patients sit for like 2 months and like, hey, I'm ready for the next thing, and that's okay with me. And I'm like, okay, we're ready to go, let's do it. So really just don't be afraid. That's really the only thing is if you're sitting there and you're ready for the next thing, just shout it out. Yeah.
And I think the biggest thing when you're working with therapists is having that cohesive relationship. Mm-hmm. So being able to collaborate with your therapist and say, hey, that's not working for me. Mm-hmm. I saw this, do you mind if we try this? I'm really having some pain or soreness in this area. How can we address it? I think being able to collaborate with your therapist, and sometimes it's, based on a relationship with them. So, looking around and shopping around for a physical or an occupational therapist, I think is very important, especially in today's day and age. We're very lucky that we work in a setting where we get a lot of one-on-one time with our patients. It doesn't always happen in certain physical therapy settings. So you really want to shop around, ask about their patient-to-therapist ratio, because you're working with a diagnosis that's very variable and really needs a lot of one-to-one care. So you want to be able to make sure that you get to a place where they can treat you in a way that's going to work for you. I think John's been raising his hand forever.
Can you make your PowerPoint available to the board and
Sure.
give permission to put it on our website?
Yeah,
Yep,
absolutely.
definitely.
Yeah,
Yep.
absolutely.
I think you did a wonderful job.
Oh, thank you.
Thank you.
Yeah,
Thank
yeah, we'll
you.
definitely make it available.
Yes.
The silverware, can you buy those in large handles at 54 and the different health store?
Amazon is the greatest thing
Yeah.
ever. I like use it. Like when I first started, I feel like you couldn't even find them on like Amazon or on the internet. You can find them at health stores. I don't really tend to see them on like Macy's or Bed Bath & Beyond, but Amazon is fantastic. Just searching for things like large-handled spoons and forks. You can find a lot of this equipment, and then if you don't like it, you send it back.
Yeah.
You know,
Yep.
so it's a win-win
We
situation.
don't work for Amazon.
Yes. We're based out of Mountainside Hospital in Montclair, New Jersey. So we're a partner within the Hackensack Memorial Health Network now. So we're one of the small community hospitals in there. I didn't bring any cards.
I thought about this morning.
We will send
Your information too.
send Nick. Yeah,
Does it have? I don't know if.
I don't know.
Yeah,
Okay, we'll send everything
yeah, that's sorry.
on the
Okay.
website. Yeah, that's absolutely fine.
Very good.
Yeah.
Yes.
Yep.
Sure. Mhm. Yeah. Mhm. Mhm. That you're moving. Yeah, that's a good point. We were talking a lot about energy conservation, so his question is, working in a sedentary job, how do you balance and make sure that you're not just sitting all day? So pretty much if you're working in a sedentary job, we always just recommend every 15 to 30 minutes, getting up, just taking a walk to the water cooler or back, or getting up, or if you can't get up, you just move your arms every 15 to 30 minutes. And just that quick little just pace down is going to be enough to make sure that you're still keeping the efficiency, but you also want to make sure that you are setting exercise time aside, either before your day or at the end of your day, to ensure that you are focusing on fitness. And so when you do set that exercise time aside, you do want to make sure that you are, again, looking at that scale and making sure that you're not going into the very hard. You're just getting a little hard, right?
Yep.
Oh. We'll go here, sorry. Mm-hmm. Mm-hmm. Yeah. Mm-hmm. Uh-huh. Uh-huh. Compensation. Yep. Uh-huh. Mm-hmm. Mm-hmm.
And my foot's starting to drop, and I'm tripping over my left leg. Physical therapist notices that was awesome.
Mm-hmm.
Landing on the right, and then I go down.
Mm-hmm.
And then I get hurt, and then it's a whole cycle. So, like, I don't know how to use physical therapy where it's covered by my insurance, and I can still address these issues. Like, my doctor doesn't know what to order, but he just gave some insight, just an evaluation.
Yeah, just an evaluation. So there's other reasons why you also might be having some sort of tripping or balancing issues that a doctor doesn't like test for, and a physical therapist. Yes, And a physical therapist will test and look at all the different systems, and they can also be that middleman that if you need maybe that orthotic in between the exercise, or maybe you need a new assistive device, but they can look at you specifically and see what you need. In terms of insurance, every insurance unfortunately is different. So with Medicare, there is a cap for the year, so that is kind of important to know. There is a cap for the year. There is also a second tier to that cap, though, too. That's $1,900 first for the first cap, $3,600 for the next cap. There's other insurances where they have a limit as to how many, 30 visits per year, and sometimes they combine that with OT and PT and speech therapy. So it really just talking to your insurance company specifically and understanding that. I'm sorry? If you have a supplementary insurance, then that can help, but again, yeah.
What Medicare does,
Yeah.
yeah. So usually when you have a supplement, usually with Medicare, when you have a supplement, what Medicare, if you're getting billed $100 for a therapy session, Medicare will cover 80%, and your supplementary
they'll
picks
cover
up
the
20. So it increases the amount of time you can have between, prolongs the amount of sessions you can get, because you're not reaching that cap as quickly, because 20% of that charge is getting covered by your secondary. And that's a whole insurance issue. It changes, and sometimes with you can work Medicare sometimes a little bit to get with letters of medical necessity from doctors and things like that. You can get exceptions to get continued coverage, but it all depends on your insurance. Yeah. Yeah, they equal out in the end, I think, yeah. We got a question back here.
I think
yeah.
over here.
Hold on one second. Sorry, I'm sorry.
Yeah, the EMG test is ordered by your physician. Mm-hmm.
Yeah.
Sure.
My legs have been, I've been neuropathic.
Mm-hmm.
And if someone tries to touch my leg, it hurts.
Mm-hmm.
So can I tolerate it? And I never thought about the evaluation. It's pretty clear
Right.
what's going on.
Yeah. You might not, you're most likely not going to tolerate it. At the same time, you have to think about, do I need that EMG? We already know what's going on. So for some people, they might need it because they have no idea what's going on. So then that's when it comes into play. We already know what's going on, so there's really no point into having it. So then just kind of working with your physician or your therapist to try to address those symptoms, trying to you can cope with it a little bit more easier. That would be the goal. Mm-hmm.
When a lot of us got polio the first time, we couldn't do anything. So
Mm-hmm.
the therapist would actually take on the leg or whatever
Mm-hmm. Mm-hmm.
and move it and exercise
Yep.
it for us.
Yep.
So I saw a physiatrist just a while ago last year,
Mm-hmm.
and I asked him, it's pretty clear, I think you have to.
Mm-hmm.
And I said, what about fasting? He said, I don't like that about either. But the question to you
Mm-hmm.
is, do you have to exercise?
Yep, so physical therapists will do passive range of motion. We also do passive exercises to try to increase joint nutrition, increase tissue extensibility, and even just relax the muscle, right? Our goal is to teach you how to do things on your own, though. So to do passive for like the whole year isn't going to be beneficial for you, right? But if we could usually, depending on what's going on, you can start with it. And there's what's called active assistive, where you can use tools to then help move it also as well. And so there's straps and things that you can use so that it becomes a little bit more passive without having to be so taxing on your legs. Oh, we're there. You come on down. Yes, sir.
Yeah.
Good.
Somehow affects the nerves and it works very well.
So I don't know if anybody heard that. So what he was saying is that in order to alleviate some of his pain at night, he gets some cramping in his legs. He uses Vicks Vapor Rub as a pain management technique. So I think we live in a time where pain management is a much more accessible thing for a lot of people. So using things like Vicks Vapor Rub, there are. You always see Shaquille O'Neal in those commercials for like those personal TENS units and icy hot patches and things like that. So there are so many options out there that can be used to alleviate some pain, and you just kind of have to find what works for you. And talking to your doctor about what roads to take there is very important as well.
Yeah, I think the important part to know with that, even if it's a lot of times they think, oh, is it just a placebo effect? And it's just all in their head. Who cares? Pain is is all in the mind, and there's so much research in how we need to address the psychological aspects of pain. And if Vicks Vapor Rub, icy hot, even just lotion, even just touching the leg gives you some relief, go for it. Go for it. Yes, we had a question.
Some of us that are fortunate that do have our mobility
Uh-huh.
somewhat yet. What is a good range for steps?
Well, in terms of steps, the general rule has been 10,000 steps. That's what they have done with the research. But again, that's a very general range. So as long as you're moving throughout the day, that should be your goal. And always just trying to beat your goal that day. So I can't prescribe do your 10,000 steps, do your 8,000 steps.
Yeah.
Just making sure you're moving and choosing to move instead of sitting. Yep.
But 10,000 isn't like over-aggressive unless it's kicking our butt.
Yeah, exactly. So again, it's learning your body. If I'm tired after 5,000, I'm going to stop at 5,000. Yep.
Just to clarify my understanding, EMG stands for, and what type of test?
The EMG, yep, so EMG, so it's an electromyograph test. So that's actual needles that get put into your muscles. So that's why it's not tolerable. It's very painful, actually. But it does test to see if am I weak because I'm not exercising, or am I weak because there's actual nerve destruction going on? Mm-hmm. You're welcome.
Yes.
Yep. Mm-hmm. Mm-hmm. Vascular. Mm-hmm. Uh-huh. Uh-huh. Mm-hmm. Mm-hmm. Yeah, swollen. EMG. It can and it can't. So if it's because, unfortunately, I can't know until I guess you were looked at. It could be because, there is a decreased muscle activity and we need muscles to work for it. And again, at the same time, you might just also, even using passive exercises that we were talking about can also help with increasing mobility. So it could be a combination of muscles not working, or it could be just your joints are tight, things like that. So it's a very uncomfortable test. So really what the goal would be is if you would see your therapist or a specialist, they work on it first, doing the conservative, invasive methods first, seeing if that works, and then if it doesn't, then probably going to the EMG too. You're welcome.
I don't know. His question was if you have twitching in your muscles but no pain, and how to alleviate it. Usually, twitching is more of an effect on like a cellular level in our muscles. So sometimes medication, stretching might help to alleviate it a little bit. I'm not entirely sure on that area.
So when it comes to twitching pain, you're thinking, okay, there's some sort of activity going on in the muscle. Now, is that twitching because there's some cramping and there's some tightness? Is that twitching because, okay, I'm having some nerve damage to the area? Really, it's kind of a trial and error. So if creating more extensibility, stretching it out helps, then we know it's a muscle thing. So what I would try, where does the twitching usually happen? Does it in the calf or in the shoulder? And specifically one? And is it after activity? So if it's usually not because of activity, you might want to just try moving it up and down, seeing if that does anything. Unfortunately, there's going to be no real cure for it, except maybe giving a gentle massage technique to it, because then that'll deactivate the muscle a little bit. So that would be the other option. Yep. Mm-hmm. 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 Buzzing. Uh-huh. Uh-huh. Yeah.
She's getting, so she's right off of Nick here, and she's explaining her twitching sensation as a buzzing. Yeah, in her muscles. And it all goes along with that the neurogenesis of kind of the muscles that are being denervated and things like that. So it kind of goes along with it. Everybody feels it in a different way. Yeah. Yes.
Mm-hmm.
Yeah.
Yeah, so with restless leg syndrome, yes, again, so with polio and post-polio syndrome, it has to do with nerves degenerating. So you are going to have an increased, you're going to have increased chances of getting things like restless leg syndrome because, again, you're getting that nerve irritation, getting nerve degeneration. And so, again, so really for all those nerve issues, trying to turn off the nervous system at that moment or in that area, or trying to turn off and overriding it with a different sensation. That's why stretching and massage will help with that, because then you try to override the nervous system at that point. Essentially, the lay way of thinking about it. Any other questions?
Any more questions?
In terms of
Like each
well, they do have something called TENS machines that do help. Those can override it. Those are, again, not cures, but if those help, and it's something like when you have chronic nerve issues, those will help, and you can get those TENS machines for home to override it for that moment. Yep, definitely. And again, a therapist can help you determine, do you need that? Is it appropriate for you? Mm-hmm. Yes.
I can hear you, yeah.
Mm-hmm. 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 Uh-huh. Did you see a therapist? Who did you see for vestibular therapy? A physical therapist or a doctor? A vestibular therapist. That doesn't sound like it's necessarily polio related. Yep. So again, you'd have to get evaluated. Maybe they missed something. Maybe they didn't. So you can get reevaluated to see if there's anything else you can do. At this point, if there's certain extreme weakness and things that you can't, it would be just a lifelong way that you just have to keep doing the exercises over and over. But again, you'd have to be seen by a therapist to see kind of what we need to do next, the next step for that. Yeah, so then you'd have to look at different factors. Is it a cardiac related thing? Is it also a vestibular issue still, or is it have to do with something else? So you'd have to get reevaluated because there's so many different factors that can create dizziness and lightheadedness. We do have a therapist who also is vestibular trained, and he specializes in pointing out specifically what is the cause of your dizziness. And if it's something that we can help, we help you. If it's something that we need to refer you out, we refer you out. You're welcome. Any other questions?
Questions? Yeah.
Yep. Mm-hmm. Yep. Yeah, so the big thing is finding the right person for you. We're all, like I said, we're all different. You might need to see a specialist, a neurospecialist. You might not. So finding that great middleman.
Okay. Let me just make an announcement. Hi, everybody. Let's have another big round of applause for Marguerita and Melanie, who did a wonderful job.
Sorry, I told you.
And they do have time for one or two more questions, so if we have any more.
Yeah.
Okay.
Oh, yeah. 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 Mm-hmm. Mm-hmm. Yeah. Well, the other option, I mean, how long ago did you try the orthotics? They do now have lighter material, but also, yeah. You can try something else, but the big thing is also, can we also strengthen other muscles so that we can de-weight that a little bit? Otherwise, then, yeah, if you've tried a lot of things, then there's no special other things. Yeah.
Really, within like the past 5 to 7 years, I think there's been a big change in the orthotic industry. I think things are getting a whole lot lighter. So if it is something that you've had for a long time, I mean, even the orthotics you had as kids,
Yeah.
it depends. There's a lot of changes going on in orthotics, but you just, orthotics and prosthetics,
Uh-huh.
Yeah, some like carbon fiber and
Yeah.
things like that tend to be a little bit easier. Yeah, you got some guys over here as well.
Yep. You might.
Yeah.
You're good? All right. Thank you very much, everyone.
Thank you, guys.